So we've got Dr. Tom Sherman here. And just to introduce myself, I'm Bill Bilodeau. I'm the managing editor of news operations at the Sentinel. We've got our State House reporter, Rick Green, publisher, Tom Ewing. Just so you know where everybody is, if the little names aren't showing up. What's up, Doc?
Well, I'm happy to tell you a little bit about who I am and why I'm running, if that'd be helpful. Or
yeah, that's fine.
Okay, so let's see. I have, I've been a doctor for 35 years. I've been a state rep for 2 terms, a state senator for 2 terms. I first discovered my passion for service as a volunteer EMT in high school. When I was 17, I was driving an ambulance and I was in charge of patient care. And that, I'm not sure, I was joking with the chiefs of police that I'm not sure that, or chief of fire at St. Anselm's, that I'm not sure that's legal still, but it was back in 1974. And it was amazing. And it taught me I really wanted to do this for the rest of my life, helping others. So I went into clinical medicine. I was a gastroenterologist for 35 years. I spent, you teach a lot when you're a doc, but you also learn a lot. And the 2 biggest lessons I take home from having been a doc for 35 years is, number one, that every relationship I had with patients, with their families, or with colleagues had to be built on trust. And the second one is that you had to listen. If you didn't really learn to listen, and it's really what I've learned over the years is it's a learned skill. When you pay attention to what people are saying, that's how you make sure you don't miss a diagnosis. There are clues in what they're saying. And those have been critical lessons to carry forward to the legislature. So in the legislature, reaching across the aisle, finding that little tiny thread of common ground, I've been able to work on both sides of the aisle and lead on Medicaid expansion, lowering prescription drug costs, setting into law some of the toughest drinking water standards in the entire country, protecting our firefighters from PFAS, and most recently, one of the pieces of legislation that really is sort of, I believe it's a step toward the future, is promoting manufacturing here in New Hampshire with my Buy American bill. That same kind of listening and building relationships has been what I've been doing since March on the campaign trail. And for me, it's been an incredible experience. Met some amazing people. But what I'm hearing is that families are deeply concerned about their monthly expenses, their costs, like skyrocketing housing, property taxes. Those aren't monthly, but they are definitely impacting. There was a woman in Berlin who has an $11,000 a year property tax for just a modest home. And Berlin, of course, can't afford a chemistry teacher. So she's very concerned. And then the other is doubling of our energy rates under Sununu. And from parents, I'm hearing about childcare that they can't find, and the quality of public schools. And from businesses, literally everywhere in the state, all the way from the North Country, Berlin, Gorham, Littleton, Lancaster, all the way down to Keene. In fact, Keene is one of my favorite examples. There's a factory in Keene where they want to open a 3rd shift and they can't find workers. And when they do find workers, they finally found a shift director. It takes an engineer to do that. They couldn't find housing. And over in Hopkinton, stopped off for, by the way, they have the best maple bacon BLT in the entire state. But I stopped off in Littleton at a little store on a busy, I mean, really busy summer weekend, and they were closing at 3. Normally it's their busiest, those are their busiest weekends, but they couldn't find workforce to stay open through the weekend. But what's really remarkable to me is that Sununu is just not listening. He's taking the state off track, and he's doing whatever is necessary for him to promote his political career. And that's why he's doing things that are truly not New Hampshire, like putting in place the first abortion ban in modern history. And he says, well, it's only 24 weeks. First of all, it was never necessary, as all the testimony said. Second of all, it actually has an incredibly harmful impact on New Hampshire, putting women at risk, because what people don't understand, what I explain everywhere I go, is that in the 3rd trimester, a woman facing an absolutely horrible complication of her pregnancy, where her life is not necessarily in jeopardy, but it's definitely seriously impacting her health, she has to wait. She has to wait until she's sick enough to actually have definitive intervention. And she's sitting there waiting, and the new addition to the team, it's her team of doctors, maybe her family, and now there's a lawyer there. Because if they go too early under the Sununu abortion ban, and this is absolutely serious because it's already happening in other states like Texas, what happens if you go too early in New Hampshire now, you have a felony conviction on the medical team. If you go too late, the woman and the fetus will die or could die. So for him to minimize that is just not realistic. It was never necessary, and it's putting a burden on women at a time when they really need to be supported, not attacked, that they've never had before in New Hampshire.
Okay.
And just a couple other quick things.
Sure.
He's not living up to the standards on public education. He's targeting teachers with divisive concepts, and the voucher ban is one of the most expensive in the country. The voucher law, and it's now $10 million over budget. We need to get New Hampshire back on track. We need to focus on people. We need to lower costs. We need to restore freedoms, and on energy, we need to have the freedom to develop our own energy sources, which we don't under Sununu. On choice, women need to have the freedom to make their own healthcare decisions, and I'll restore that as governor. And we already have plans in place, strategic plans, which the governor rejected at the last debate, which is amazing to me. We already have strategic plans in place for lowering cost and also housing. So I'll stop there and love to take questions.
Yeah. So I'm going to start with something you mentioned a couple of times, which is energy prices. So as we've been talking to people, this campaign, Republicans say that New Hampshire energy prices are high because of nearby states on our grid to move to renewable sources that at this point still cost more. New Hampshire is the only New England state that's not moving toward renewables, as you kind of hinted at. So if renewables is the goal, then how do we get there without driving up costs short term?
Well, first of all, their assertion is ridiculous. And the idea that moving towards renewables for other states is driving up the cost in New Hampshire. What's driving up the cost in New Hampshire is that we are behind every other state. We're so far behind every other state that we don't even fit on the same graph. So when a state expands their own portfolio by embracing renewables and allowing, for example, businesses to go up to 5 megawatts of production, returning some of it to the grid, but actually, being able to cover their own costs, that cost drops for that facility, and they're putting back into the grid renewable energy. we have a huge capacity to develop renewable energy, and the governor has blocked it at every turn. And it's no surprise because one of his principal donors is one of the utilities, and they're very happy. He's been very loyal to them. But New Hampshire granite staters have paid the price. And the way they're paying the price is our reliance solely on the grid, and solely, almost entirely, well, not entirely, but much larger proportion than any other state on natural gas. And that is it's like all your eggs in one basket. We wouldn't do that with a stock portfolio. We wouldn't do that with any portfolio, but the governor has done that with our energy portfolio. 3 pieces of evidence that he is actually the one to blame. Now, we all know every state in the country is dealing with the Ukraine crisis and increased fuel prices. So that's true. But the states that have really expanded their renewable portfolio have had lower impact, as you would expect, than a state that is almost entirely dependent on fossil fuels. So 3 pieces of evidence. Number 1, the experience of the states around us. It's disingenuous, and I will use the term again, it's ridiculous to blame other states for New Hampshire now having higher costs. New Hampshire has predictably higher costs because of our dependence on fossil fuels. Number 2, there's a 4-year study that came out of Boston that showed that as opposed to what Sununu has always said, that the ratepayer is going to pay, when states embrace renewables, guess what? There's a shift in the benefit of the ratepayer, and that came out at $1.1 billion benefit. And finally is the prediction that the state asked for from a Canadian firm that came down and did a full audit of what would be the impact of moving towards renewables. And they saw over a 90% reduction in costs when solar is embraced. That is their prediction for New Hampshire. And this is a state-sanctioned or a state-funded consultant from Canada who just did that. So, and that's over 35 years. So this is, they can say it all they want. That doesn't make it fact. All of these pieces of evidence show that had we done what Republicans and Democrats wanted, the direction they wanted the state to go, we would be in much better shape right now. Would we have been able to avoid all price increases? No, because no state has done that. But would we have been able to not have a doubling in many cases of our electric rates? Absolutely. And that's what other states have experienced that have expanded their portfolios.
So if you were to take over as governor and we're in the situation that we're in, what moves would you make to lower costs for granite staters in the short term?
Well, that comes back to one of the other parts of this, the other piece of the puzzle that the governor has blocked. Back in 2019, bipartisan bills to expand our efficiency programs, especially for low-income homes. There was a very robust a very robust efficiency program, weatherization program called New Hampshire Saves, which I'm sure you know about. Concord was going to launch that in March of 2021. They had the whole thing ready to go. It was sanctioned by the PUC. It was supported by all the utilities. And under the pressure of Governor Sununu and Michael Vose, the PUC pulled the plug on it. The outcry was so overwhelming from every stakeholder. This wasn't something where it was just being asked for by the environmental community. This was embraced by every single stakeholder except the governor. With that outcry, they introduced new legislation on an urgent basis that restored some of the efficiency and weatherization programs, but not all of them. That is actually the best bang for your buck, is when you decrease the amount of utilization of energy in the first place. So when you ask what would I do immediately, I would do what we tried to do on veto day, which is to put in assistance for low-income homes and housing that would allow moving forward with weatherization and efficiency programs. That, had we been able to get that through on veto day, that could have been in place. Some of the programs could have been in place before this winter, helping people lower their costs by this winter. That's something we can do fairly quickly. We also know that there are investors who have somewhat given up on New Hampshire when it comes to solar and wind. I'm really excited about offshore wind. I serve on the BOEM task force for offshore wind. I think the complement of offshore wind and solar is huge because when solar is less efficient, we have offshore wind being at its peak efficiency, and that's in the winter. So they complement each other, but whether it's wind, hydro, or solar, onshore wind, hydro, or solar, those may take more time. We are behind the 8 ball. We're behind all of our neighboring states. That's why we're on a separate graph, and that's completely, the governor is completely accountable for that delay in our ability to implement these programs.
So energy prices are certainly an issue on people's minds, but obviously that's just part of a larger price pressure on everyday people. So in terms of more general inflation, what's the state's role? How can the governor of the state play a part in helping people out with that?
Yeah, so cost in general, we did release a piece on how to reduce cost for Granite Staters. If you didn't get it, we can bump it back to you. But one area where I'm really interested, I don't know if you followed the Buy American bill, but the Buy American bill was one that I introduced. It supported 4 steel fabrication companies in New Hampshire. Their total hiring is 250 employees between the 4 of them. It had bipartisan support. It was to avoid what we've seen in Western Pennsylvania and the Ohio River Valley, where we have these hulks of former manufacturing plants. We can't afford to lose those. So it was just a small step, but it ended up having bipartisan support. And it's a great model for how can we make sure we are increasing what's made or grown in New Hampshire. And one of the areas where I'm really interested is in agriculture. You have in Cheshire County, you have some really dynamic farmers. They are very motivated, but at the same time they're motivated, the supports from the state, whether it's on dairy, whether it's on organic, we lost our organic certification as a state. That means we've lost, for example, Horizon, which is an organic dairy seller of dairy products. They have ended up, one of my discussions with the dairy farmer was Horizon won't even buy from a New Hampshire producer. We have to change that. Because if we do things like your farmers co-op in Keene, if that becomes the model, by the way, there are really successful farmer co-ops in Littleton and Keene and other places, and we promote what we can do within New Hampshire to do our growing or manufacturing, we can lower costs in New Hampshire. We will be less reliant on what's coming in from outside the state. So that's one. 2 is some of the other cost drivers are property taxes, and another one is childcare. Working with businesses, we can lower costs by giving businesses tax breaks for making childcare more affordable. The governor has not used all of the federal funding that was made available for childcare, which is very unfortunate because we have to rebuild the pathway where where the providers come from. So we have been shutting down our early childhood education programs in our CTE schools. We need to put those back in place. Once we develop that pipeline again for workforce, for people who are interested in early childhood, and those child care facilities can once again be fully staffed, we can lower that cost by incentivizing our businesses to make that part of their benefits package and make sure they are supported with tax breaks. And those are the kind of very common sense, but also direct relief provisions that we can provide on cost, whether it's energy, property taxes, food. We can lower the cost so that people will have more resiliency in their budget when there are things impacting them that we can't control, like national level inflation or national level increase in fuel prices.
Senator, if we could return to the abortion rights issue for a second. Mm-hmm. Should New Hampshire have any restrictions on abortion?
Well, there are no elective late-term abortions in New Hampshire. So do you want a law that really doesn't impact something? We know that's the case. That was testimony over and over again during the hearings. But the more important question is, should we be putting the lives of women and the fetus at risk? Remember, and should we be doing unnecessary procedures on women because they want an abortion? We don't do that to men. They are at least half of our population. And do we take away the rights of women for a problem that doesn't exist and then end up putting them at increased risk? I think that's the question. My answer to that is no. What we need to do in New Hampshire is put the protections of Roe versus Wade. We're the only state in New England that doesn't have an affirmative right to abortion. We need to put that into statute so that we are in line with our neighbors. I would love to see us protect women who come from out of state and providers in New Hampshire who perform procedures that are legal in New Hampshire from other states coming after them, because those states have decided to make abortion illegal. And by the way, that is exactly what Charlie Baker did in Massachusetts and Chris Sununu refused to do in New Hampshire. That could be an executive order. But really recognizing that women are perfectly capable of making their own healthcare decisions. As a doctor, I would never say to a man, wait a second, we need a law that prohibits you from having a colonoscopy unless you've had a rigid proctoscopy in advance. I mean, how would you feel about that? But that's what we're saying to women. We're saying that we don't trust you to make your own healthcare decisions. So we're going to solve a problem that doesn't exist in New Hampshire, and we're going to take away your rights and put your life at risk at the same time. That's what the Sununu abortion ban has done.
Yeah, you lost me on the rigid proctological.
Well, I think you'd prefer to be lost on that. But hopefully you're, just my little plug, hopefully you're up to date on your colonoscopy and screening.
Well, so in answer to that question, then, should New Hampshire have any restrictions on abortion? In your estimation, the answer would be no.
I don't think it's necessary because, we know from testimony over and over again that it's putting in a law for something that doesn't happen in New Hampshire.
Okay. And when you talk about the protections under Roe, didn't Roe talk about a viability standard as well?
And, I'm okay if we put Roe into statute in its form. That has been the law of the land for New Hampshire for the last 50 years. So I think sitting down and working with all stakeholders to have the affirmative right to have an abortion and really going back to where we were with Roe prior to the Sununu abortion ban and prior to overturning Roe, what they're basically saying is you need to do it at a state by state level. That's my understanding of what the Supreme Court said. And the state of New Hampshire had, really no issues under Roe. So let's codify that.
Under the existing abortion ban, it talks about an exception for medical emergency defined as a threat to life or major bodily function. So that major bodily function part, as a doctor, I know you mentioned that it puts doctors in a tenuous position and having to have a lawyer there. But doesn't the major bodily function encompass more than just the life of the patient?
No, I mean, not really. I mean, have you, it's really hard to talk about a clinical scenario and say that this meets every clinical scenario. In other states that have a 24-week abortion ban, they simply have a broader exception that says the health of the mother. And that really captures that area of gray zone that Sununu has brought up. I mean, I would go back to, is this necessary? No. Is it currently making an already tragic situation, like a complication in the last part of pregnancy, more tragic? Absolutely. And trying to parse out what meets the criteria that you just read is, first of all, why do we do it? Why do we put people in that position? And what is the goal of this? And all it is achieving is making an already tragic experience for that mother more tragic, and it puts her life at risk. And the other part of this that, I can't underscore this enough. Dartmouth has the best, or one of the best, maternal fetal medicine programs in the country. I've said this on the floor of the Senate, and I'll say it again now, and it is critical. We had a panel discussion up in Hanover with faculty from Dartmouth Hitchcock. They have 7 providers right now. 4 are looking at retirement, and there is no way they will be able to recruit more maternal fetal medicine specialists or even OBGYN under the threat of felony conviction.
If you were elected governor, what would you do to make the situation more to your goal?
My goal would be to replace the Sununu abortion ban with the protections of Roe versus Wade. So we go back to the way we were just before June of 2021.
But how do you effect that as governor?
Well, I have to do it through the legislature. I can't do it one of the things that's very different between me and Sununu is I've been a state rep and a state senator, and I know how the legislature works. And the way I would accomplish goals, first of all, leadership is about leading people. It's about bringing people together, bringing all the stakeholders together. And I've learned some really valuable lessons in the New Hampshire legislature. The first is that if you don't have bipartisan support for an agenda, for trying to accomplish a goal, it's not going to last. It may not make it through the legislature, even if you have the majority, and it's not going to last into the next biennium when there may be a new majority. So I've seen this over and over again. The second part is that when you, as a governor, if you really want to lead, look back at Jean Shaheen, the way she did it. She worked with the legislature on the front end, said, here are the things we need to accomplish. We have so many crises in New Hampshire right now, mental health, substance use. Sununu has just sort of done what he wants to do. He hasn't brought together stakeholders at the beginning of the process to really say, how do we work together to solve this problem? That's exactly the way I would do it. And then I would follow it through the legislative process so that it's something I can sign at the other end. And that's what I would do on abortion.
You mentioned providers a moment ago. Are we facing a problem with mental health providers as we add more mental health beds with ARPA funds? Is there a lack of providers for mental health services in this state, and what can be done about it?
The answer to your question, is there a lack of providers? Absolutely. Providers at every level, whether it's at the bachelor's, master's, MD, DO, or nursing level, all of them we have a lack of providers. I actually was the prime sponsor and ushered through a bill that allowed PAs, physician assistants, to work in psychiatry. We didn't have that in New Hampshire. We also passed a bill back when we were in the majority that increased Medicaid reimbursement rates by 6%, but we're still lagging behind all of our neighboring states on reimbursement rates. That translates into wages. Our wages are not competitive with our neighboring states. People come to New Hampshire, they get their training, and then they move on to Maine, Massachusetts, or Vermont because they can get better salaries, better pay. We need to look at our processes of recruitment and retention. We need to look at our processes of capturing interest as early as possible. There are some really great models on this. In fact, in Keene, I met with the president of Keene State College, and we talked about the relationship that they have with the community college, and this idea of starting either with at the high school level with Running Start, which is the community college program, or working with the CTE schools and nurturing that interest in behavioral health, so that we can actually be growing that from New Hampshire, and making sure that people have an incentive to stay in New Hampshire. One of the ways to do that we've talked about in childcare, and this could absolutely, and we've already done it in some of the healthcare fields, is to make the process tuition free as long as you stay in New Hampshire for 5 years after graduation. There are all sorts of strategies that we can use to increase that workforce. None are in place as a plan or a strategic plan by this governor. So right now we have 2 wings of New Hampshire Hospital closed. He pulled the children out of New Hampshire Hospital. I actually warned the commissioner that if you pull the children out, you will lose the providers. And guess what happened? We took one of the top pediatric psychiatry residencies in the country, and it's now completely gone. We lost 4 faculty members when they pulled the children out of New Hampshire Hospital because they moved them off campus. And I said, don't move them off campus. They moved them off campus. So we have to start from scratch now with Hampstead Hospital. The staffing they're scrambling to find the staffing. This should never have been. We had, and we could talk about this for hours, but we had a framework for how we approach mental health with children. And it was so slow to be implemented that $5 million of the $25 million allocated lapsed. That's on the governor. That's not setting a priority. So what was the direct result of not implementing that framework for system of care for children? 51 children were sitting in our emergency rooms in mental health crisis in February of 2021. We need somebody in there who can anticipate and prioritize and actually knows how to implement these programs. That's what I've done my whole career. I've worked in healthcare. I've worked in healthcare, working with hospitals as president of the medical staff on the boards of hospitals. And now for 4 terms, I've been working on the legislative side of how to implement healthcare in the state. And it's been absolutely painful for me to watch them drop the ball over and over again.
On the opioid crisis, if we could turn to that, it seemed like overdose numbers were starting to plateau or decrease somewhat in past years. And then through the pandemic, it seems like things have gotten a lot worse. What can be done to get back on track in New Hampshire on that issue?
Many of us in the healthcare field, mental health field, and substance use field were really shocked when the governor rolled out his Doorways program. By the way, he rolled it out when the commissioner of HHS was on vacation. That so it's totally the governor's idea. So fundamentally, this program silos people with substance use and puts them in a separate program from mental health. We know that what we really need, and I think Cheshire actually had a very strong program this way. We rolled out a federal program for Medicaid recipients called the Integrated Delivery Network. Do you remember that? The IDN for mental health. The idea was that you walk into your primary care office, you can get mental health treatment. You go anywhere, you can get the treatment you need when you need it. And there's some really cool programs that are happening called collaborative care model of psychiatry that are doing that. Doorways is this silo, just like one of your dairy farms in Cheshire County. It doesn't recognize that 70% of the people suffering from substance use disorder have mental illness. So it separates them from that. When you look at the community mental health centers, and mine on the Seacoast Community Mental Health Center, it's integrated. The whole thing is integrated. But you look at the doorways. Number one, when people need help with substance use disorder and addiction, they need it the minute they're willing to get it. That's why programs like CMC, they had a program where they would, when you'd come into the ER with, this was prior to COVID, when you'd come into the ER with an overdose, they actually paired you with a recovery coach right there and then, so that opportunity, when you've been revived with Narcan, that opportunity, you don't miss it. Same thing with safe stations in Nashua and Manchester. You walk into you say, I need help, you have it. Doorways, you walk in or you call, we'll get you in 2 days to a week. It's not the fault of the people working there, it's a structural issue. And we, or at least I and many others in the field, were saying, this is not going to work. And the proof is in the pudding. Overdoses in Nashua and Manchester are higher than they were. This was just reported in the press in 2016 and 2015. And we've lost to overdose deaths more than 2,500 New Hampshire residents since Sununu has taken office. It's not getting better. In fact, it's getting worse. And so now he's claiming, well, I'm blunting the curve. It's getting worse than it is here. That's not a fair defense. We actually know how to treat substance use disorder appropriately. We know how to treat mental illness appropriately. We need to make the commitment and the investment in that appropriate treatment at every level. So when we do that, we'll start seeing the numbers coming down. Until we do that, they're going to get worse. And the failing to treat these illnesses, mental health and substance use, is driving other problems, whether it's crime or housing issues, homelessness. They're a driver of that. And so we have to we can't slap Band-Aids on this. We have to think beyond the Band-Aid. We have to be thinking about the root causes of this. And it's mental illness, addiction. And when we fully address those, we will start seeing improvement across the board on these other issues that we're facing in our cities. And Keene is no different.
I think we've taken advantage of your background to focus a lot on medical issues here. I want to move over to education a little bit. One of the core issues New Hampshire has with education is its funding mechanism. Mm-hmm. We're again facing multiple lawsuits based on inequity and lack of funds coming from the state for public schooling. As governor, how would you propose we get past that and resolve that issue.
Yeah, I think, first of all, you have one of the champions and one of the smartest people in the state right there in Cheshire County with Jay Kahn. And he's been just, Senator Kahn, he's been such a champion for making sure we are doing a good job with public education. And we are also doing a good job with not downshifting the cost of it onto municipalities. So there's several different layers to answer that. My fundamental belief is that we have to make sure a child living anywhere in New Hampshire has access to a great public school education. That should be our goal. It's pretty straightforward. But underlying that are all these inequities that you talked about. In 2019, the budget that we passed in the Democratic majority in the legislature was vetoed by Sununu. It had over $170 million more at the state level for education funding. That kind of investment, by the way, coming out of that budget, we still had a significant surplus. That kind of investment, using our surplus to invest in our public schools, is sort of the fundamental difference between me and Sununu and the Republican leadership in the legislature. We have been running budget surpluses for the past at least 3 biennia. And those budget surpluses, the Republican leadership says you can only use them for one time. That's why the relief that we passed in 2019 was not continued in this last budget. In fact, this last budget cut net more than $50 million out of public school funding, and it created the voucher program. Besides being a driver upwards of municipal property taxes, when you downshift or when you cut at the state level, you're making it harder, especially for towns like Berlin, Claremont, and others, to be able to achieve that goal of a great public school education. So there are several steps we need to take. Number one, we need to be thinking about strategic investment. This is true whether it's housing or education. We need to make sure we are focused on promoting the capacity of a community to educate their children using public education, using taxpayer dollars at the state level, so that the playing field is level. One of the areas that I'm really interested in is coming out of the commission that Jay and others were on, looking at how we fund and do education at the state level in New Hampshire. It looked at how we evaluate the success of the child versus sort of an inventory of, do we have a principal? Do we have the right mix of staffing in each of the buildings or each of the facilities across the state, the public school facilities? So it shifts to looking at what is the actual outcome? How are children actually doing? And let's go back and look at the structure that's supporting that. What that does, this is part of that commission report, what that does is it changes what we are funding to achieve the outcomes. And when you do that, it makes the whole process more efficient. Rather than having an inventory of staff for every child, you actually are saying, what do the children of Manchester need? What do the children of Keene need? Where are the deficiencies, and where can the state make up that difference? And that, I think, is really a paradigm shift in how we do our funding from a state level. When we do that, yes, the cost will go up for the state, but we have the ability to do that, and we showed that in 2019. Not only did we sharply increase state support for public education, we had $20 million in direct relief for towns for education. It was targeted for education, but there was also at at different levels, there was another $150 million increased funding, which, by the way, the governor vetoed the first time through. But he signed it when we gave him his corporate tax cuts. That type of mentality, but not doing it as a one-off, doing it as an ongoing support for our children, is the way I would approach it. We certainly have the ability to reinvest in our children, and we've already seen that we can do it and still have a robust economy. In fact, an increased surplus in the budget, even though we increased our investment in children.
So you mentioned this briefly earlier, but are there specific changes that you would advocate in the state's divisive concepts law?
I would repeal it. I think it's completely unnecessary. I think it's, it has changed. When you look nationally at ranking of New Hampshire as a state attractive to educators, we're number 50 out of 51 because Puerto Rico's in there. It's similar to putting felony in the third trimester. It's going to be virtually impossible, we're already seeing this, for us to recruit and retain teachers who come to New Hampshire and feel like a target. It's another one of those laws that doesn't address a problem. We are targeting our teachers, censoring what they teach, and all you have to do is talk to a high school social studies teacher. They have changed the way they teach. They don't teach issues that are difficult. They don't teach Indigenous peoples, how we treated them, the history of them. They don't teach the history of slavery with asking a child to think about it. What does it mean for them? They don't go into that kind of depth. They've told me this, not just in Keene, but I've been all over the state, and teachers are changing the way they're teaching so that their career is not threatened by a parent who doesn't like the way they teach. So divisive concepts is an unnecessary law. And it's so against the live free or die state. I would love to sign a bill that repealed it.
Okay.
I think you're muted, Rick.
Yeah. If we could turn to housing, there seems like there's a lot of higher end houses being constructed. Does that in any way help those in the lower income brackets? And if you could just explain your plan and how it's going to result in more housing stock where it's needed, and how it differs from the governor's plan, which seems similar in some ways.
Well, the governor's plan is a one-time $100 million all federal funding investment. He has, in fact, in the last debate in Milford, he said he doesn't need a plan. He doesn't have a plan. He has a one-time investment, and it's all federal funding. We need 20,000 units in New Hampshire right now. That's been the estimate that I've been working with. There is no way with $100 million and a one-time program that you're going to end up with 20,000 units. And so if you do nothing except the governor's plan, you're going to get nothing. 60 million of that is going to housing projects that already are shovel ready and moving forward. That 60 million, remember the first time it came through, there was no requirement for any of it to be affordable or workforce. Now it's workforce for 5 years. So what happens in 5 years? That all can become commercial real estate for rental. So the short answer is that I would not throw out the governor's plan at all. I would embrace that as a start and say, let's move forward from that starting point and have in place a housing plan, which we call Building New Hampshire Values. It's on our website. You can pull it up. It has essentially 3 components, and it's about $35 million a year. So in the first 3 years, it would pretty much double the governor's investment. So it's a really powerful jumpstart. And when we put this together, we didn't meet with a bunch of Democrats. We met with everybody. Eric Chinberg, who you may know, I don't even know what party Eric's from. We had the New Hampshire Housing Authority. We had all of the stakeholders looking at housing, all of the experts. And that's the way I like to do things. But I also like to work from a strategic plan. I don't know any business that doesn't work from a strategic plan. And certainly, I think the state will be in a much better place if we say, let's set our targets and let's go after them with a plan. So that's what this does. It may take 5 years, it may take 10 years to get to 20,000 units, but it will get done if we implement the plan. And the first part is to help municipalities. We are not telling local municipalities what to do. We are saying, if you want to increase your housing for your police and fire and school teachers and your seniors so that they don't have to leave the community and they can't live in your community, we will provide you with grants to actually help you update your zoning laws. We will work with you on whether we can devise templates that could be applied to your codes and your zoning laws so that you can update. Many of those are dating back to the 1960s, and we all know what was built in the 1960s. Actually, maybe we don't. I certainly was around back then, but I don't want to make you guys as old as me. But then the second component is to say, let's make our successful programs that already exist more robust. So we're tripling one of them, we're doubling another, and then we're actually looking at a program that Maine has that uses, that helps promote the federal grants to make sure that those are fully implemented. And then the third component of it is to make sure we have the workforce to actually do the construction. And that's from talking to people in the workforce, but also people who are the commercial and nonprofit developers. They're saying, we are having trouble finding people in the trades. And so making sure that we are addressing that, one more workforce issue, but making sure that we are addressing that workforce issue. And again, there's some really exciting possibilities in New Hampshire, but we have not tapped into them in any meaningful way, whether those are at CTE level, whether they are the trades providing their own. Some companies are starting to provide their own. Revision Energy has a pathway to a journeyman electrician right on campus. So there's a lot of innovation going on, but we need to make sure we're embracing that.
And so that would attract more workers by boosting the pipeline for producing those workers, or are there other ways to attract more workers?
Well, we can do on these kind of projects. It's really increase in pipeline. These are solid, good paying jobs, and we all know that. Somebody coming out of a construction program at Seacoast School of Technology is getting up in the well above $60,000 to $70,000 a year starting salary, coming out with their if they're moving in an apprenticeship program. So we know that in the trades, these are solid jobs that can move forward. We can also, depending on our pay scale and our protections for the workers, we may be able to attract people from Massachusetts, and especially given the lack of income tax. I remember when I came up here from Massachusetts, I was working for 2 years in Lowell, and didn't love the commute. And when I came up, my salary was essentially the same when I came up to work at Exeter, but I got rid of the 5% income tax. And so we have several things that are sort of inherently more attractive about working in New Hampshire from a pay scale that we can take advantage of.
Talk about taxes. The governor talks about cutting business taxes. He says that's worked. You have different statistics, I think. So if it hasn't worked, how would you do it?
Well, I'm not saying, I think it's wrong to say that I think the reality is his only plan for our economy was to cut business taxes. And, I voted for some of those, not because I thought they were necessarily the right thing to do, but because there were other things attached, like more funding for education, those kind of things. I would not continue business tax cuts at this point. I would focus on property tax cuts. And I don't know where he got this notion, but he said the state government doesn't set property taxes. We certainly have a strong impact on property taxes. And all you have to do is look at the last decade of downshifting, whether it's zeroing out the state assistance for for municipal pensions. We started out with 30% in 2010. In 2011, the O'Brien legislature zeroed that out, and the state has never made good on that. That was part of a state commitment. The governor in the last budget cut rooms and meals by 25%, the amount of rooms and meals going back to municipalities from 40 to 30%. School education funding, they've cut that by $50 million in the last budget. Putting in place the voucher program, that's going to drive up property taxes. So what I've been saying is we need to focus on the people of New Hampshire, put more money in the wallets and the wallets of the people and businesses of New Hampshire. And we do that by lowering property taxes, lowering energy costs, allowing businesses to produce their own energy, by lifting the net metering at businesses up to 5 megawatts. Doing all of these things, focusing on what's happening right here in New Hampshire, rather than giving tax cuts mostly to large out-of-state corporations, is the way I would focus. And by the way, my focus on property taxes is really trying to get them down and focusing on that. And I've done that in many different ways. My voting has been consistent on that. But I would veto an income tax or a sales tax if it came across my desk. I don't believe we need it. I don't believe that's the New Hampshire way. And so the governor keeps harping on income taxes. I've never voted for one. I've never voted for a sales tax. But I will do everything I possibly can to decrease property taxes.
So one alternative is New Hampshire seems to rely heavily on so-called sin taxes. One thing that's been talked about a lot, and I think you recently said you would favor, is decriminalizing marijuana use so that the state can make use of some of the money that's now going to neighboring states where people are going to purchase elsewhere. In terms of doing that, though, as a doctor, how do you feel about studies that indicate that doing so increases use by teens and young adults in states that have done that?
I don't think those studies, I don't think there are any studies that show, the governor says we shouldn't be doing this in the face of an opioid crisis. Actually, there are studies that show that opioid use decreases in states where they've legalized marijuana. I'm not talking, we've already decriminalized the use of marijuana in New Hampshire. I'm talking about making it legal. I actually went to one of the growing facilities in Massachusetts yesterday to see what it's like and understand what they do, and also understand the state legislator from Massachusetts, who was the driving force behind this, was at that. Her name is Representative Tyler. And so we were able to talk about this. I've talked to J.B. Pritzker, who's the governor of Illinois. What has been the impact? Opioid use has gone down. There has been no increase in crime the way that people claim. This is not the end of the world. And more than 70% of people in New Hampshire have said they favor this. From a physician standpoint, I understand marijuana. I understand the use. I understand that a child in New Hampshire who wants marijuana can get it, but they're getting it from a dealer. And that same dealer, when I was on the joint task force on the opioid crisis, all of the people in recovery who testified at those hearings said over and over again, and they've said it to me since then, the gateway here is when you go to a dealer for marijuana. Number one, you don't know what you're getting. And we're seeing that marijuana is now laced with fentanyl and other substances. Two, they have everything else that you might end up migrating towards, whether it's crystal meth, heroin, fentanyl. They have that access, cocaine. Whereas if the state actually regulates the sale of cannabis for adult use, you start putting in some of those safeguards that we currently don't have, even though access is there right now. Adults go across the border and buy it in Maine, Massachusetts, and Vermont. Children buy it from dealers. I mean, I'm talking about people under 21 buy it from dealers, and they are buying it from people who have access to everything else, and they don't know what they're getting. So we're seeing those unanticipated overdoses because the product that's sold in New Hampshire is laced with other substances. So a well-regulated industry where we are capturing the tax dollars is what I would favor, with a really strong emphasis on making sure that any marketing or availability is not targeting anyone under 21. And we have experience with that. We know how to do that, whether it's tobacco or vaping. We know how to make sure we control that marketing. We certainly did a terrible job controlling the marketing with vape products in children.
So we've been talking for a while. I do, before we let you go though, want to ask one thing that during the pandemic, the governor, as governors all over the country did, issued emergency orders to deal with the pandemic. And apparently that rankled some in the legislature. And so now the legislature adopted restrictions on the governor's emergency powers as a response. As a current legislator, but a potential governor, what are your thoughts on those limits and how the governor should be able to exercise emergency powers?
We saw legislation come through in the past 2 years that really was aimed at dismantling our public health network that allowed us to survive COVID, dismantling the governor's powers to keep the public safe. I believe that pushback was largely political. It wasn't based in science or clinical medicine, the pushback that ended up with these bills coming through. There were a series of bills that were saying that businesses can't have their own rules and regulations. These are from the same people who say we need less government, and they're telling businesses what they can and can't do. Fundamentally, as a physician, the next pandemic isn't a matter of if, it's a matter of when, whether it's a new variant of COVID or it's another type of virus, a completely different type. Remember, we've had Ebola, we've had SARS, the other SARS variant, the other SARS viruses. We know this is going to happen in the future. And God forbid it's something with the contagiousness of COVID, but the toxicity of Ebola. That's possible. Can you imagine a governor who can't do what they need to do based on the science to protect the public? I think this is misguided and it's not based in science. And when you issue an emergency order, there's an emergency. It's not, I don't believe Sununu issued emergency orders in a way that was politically based. I think he did it because his healthcare advisors and public health department was saying, we need this to keep the people safe. And every other state around us was doing it. They just did it a little sooner than he did. So I think it's short-sighted and an inappropriate response to something that has claimed so many lives in New Hampshire to limit the governor's responsiveness and ability to protect the people of New Hampshire.
Okay.
Senator, I just have one question, if I might. At the outset, you talked about going around the state and getting lots of views of people and how you learned how to find a thread of commonality with people. But these days, there seems to be less commonality out there, and you certainly strike me as someone who, for instance, is driven by following science, for instance, and there are others who take an alternative view. So is there a way for you as governor to find commonality with those people?
Well, first of all, I think the first thing you always need to do is keep the lines of communication open and continue to listen, even if you don't like what you're hearing. So there are people, for example, in the Free State movement who I have continued to work with, not just because I have to, but because I want them to see alternatives to the point of view. There's a bill, we have a board that is the result of my legislation called the Prescription Drug Affordability Board. There's already a bill filed to repeal it. It has been doing great work on understanding why prescription drugs are so expensive in the state. And the prime sponsor of the repeal and I have already talked about what are the concerns that bring this forward? Can we address those concerns without throwing out the baby with the bathwater? That's the kind of thing I do, is I don't say, oh my gosh, this guy is awful. I'm not going to talk to him because he's trying to repeal a board that's doing effective work. I reach out to him and I say, where is this coming from? Can we talk about it? And that's how we move forward, that's how, not judging people because of a bill they've filed but trying to understand what has motivated them to do that. What are their concerns? Can we meet those concerns? Is there a way we can build? And there was a great example on this with the State Health Assessment, State Health Improvement Plan Advisory Council. That's a mouthful, sorry. We call it SHASHIP. And one of the state reps actually put in a repeal. We sat down, we talked about it, we found common ground. And by the way, the amendment that he filed, I signed on to it because it made the advisory council stronger. And we got it, and I helped usher that through the Senate. So you start out with reaching out and building that bridge. And that's what I've always done. I really, I've always won in a Republican district, whether it's as a state rep or as a state senator. All I care about, I don't care about your party. I care about solving problems. I care about and the thing that's been so frustrating to me is that our current governor doesn't have a plan for these issues that are the crises. The housing crunch became a crisis under him. There was no plan. We've been watching this coming. We've been trying to get legislation through. Energy, same thing. My approach is to try to capture something as early as possible when you first know it's a problem, devise a program to actually address it. And not only are less people hurt because it's not getting worse, but it's less expensive. It is much less expensive. I know this from my medical background. To treat an infection before it becomes an abscess, it's much less expensive. It's much less expensive to prevent cancer in the first place than to have to treat somebody with metastatic cancer. Bringing some of those lessons to the legislature has been really important for me, and I think it's part of why I'm able to work across party lines, and I never shut somebody down. I never say, I won't talk to you. And that's why when I handed in my pink card to introduce one of my bills in the House, the chairman of the committee said, this is a Republican, said, I'm looking forward to you being a governor because your door will be open to me. And that's the way people have asked, how do you deal with division? I say, you talk and you listen. It's not always going to work out. Sometimes you all know, sometimes you have to decide that we're just not going to be able to move forward together. But if I don't find that common thread, I almost always find somebody I can continue to talk to and keep a dialogue open.
Well, I don't know that we can finish any better than that. So, we'll thank you for your time. Thanks for spending a few minutes with us, and good luck in November.
Yeah, and if I could just make one last little statement, I have thoroughly enjoyed my time in Cheshire County. I'm not just sucking up to you guys. I have had so much fun from the Pickle Festival in Winchester and meeting some really cool people and figuring out what a red hot pickle tastes like, to working with your dairy farmers on issues on drought. And it's just been hugely eye-opening to me. And I think you live in a phenomenal part of the state with so many interesting people doing really fascinating things. So I just wanted to say something from a seacoaster coming to Cheshire. One of the real huge commitments I have is to build on the strength that you're of the projects and the people in your county. So it's been great. I've really enjoyed it.